Some symptoms of multiple sclerosis are obvious to the external observer, like significant weakness or tremor, but many of the most disabling symptoms are completely invisible, including the following 10. Remember what Mother Teresa said: if you judge people, you have no time to love them. Number 1. Fatigue. Fatigue in MS is associated with brain lesions, and many people report fatigue as their worst and most disabling symptom. Everyone describes it a little bit differently, but some people with MS will say after a good night's sleep they feel okay in the morning, but a few hours later they crash and have an overwhelming exhaustion and may feel the need to take a nap in the middle of the day. This is a little bit different from things like sleep apnea, where people may feel fatigue right after sleep because they did not get productive sleep. Also, this can be exacerbated by sleep problems in MS due to frequent urination or pain, for example. There are some treatments of fatigue. For example, a whole foods plant-based diet may be helpful for fatigue based on a study done at Oregon Health Sciences University, and the Walls diet may also be beneficial for fatigue, a paleo-type diet. There are also medications such as Provigil, Ritalin, and Adderall. Number 2. Vision loss. Luckily, severe vision loss causing legal blindness is rare in MS. In my book, Resilience in the Face of Multiple Sclerosis, the protagonist of Chapter 8, Miguel Hernandez, is legally blind, but this is uncommon. By the way, if you want a free copy, you can simply ask me on Twitter, and I'll include a link in the description of below. But a lot of people with MS have milder vision loss. Perhaps they had optic neuritis years ago and recovered, but still have some subtle problems such as a central scotoma or gap in the visual field, or color vision problems, or decreased visual acuity, and they may function okay and be able to drive and everything, but it can still be a major annoyance. Number 3. Pain. Decades ago, doctors used to think MS does not cause pain, but it definitely does. Neuropathic pain, as opposed to nociceptive pain, pain caused by injury outside of the nervous system, has specific characteristics such as burning, sharpness, hypersensitivity. There are also a few MS-specific pain syndromes, such as a banding sensation around the abdomen and chest, so-called MS hug, or facial pain, trigeminal neuralgia. Luckily, there are some treatments like nutritional supplements such as alpha-lipoic acid, acupuncture, and various prescription medications. I have a separate video on nerve pain treatment. Number 4. Bowel bladder changes. Lesions in the spine in MS can disrupt function of the bladder and cause a phenomenon known as detrusor sphincter dyssynergia. In other words, the bladder is contracting, but the sphincter muscles aren't relaxing, and so there's incomplete urination, and there can actually be more urine in the bladder after urination, and this can cause symptoms like having to go very frequently, having to go frequently at night, which can disturb sleep and worsen fatigue. Also, sometimes symptoms such as incontinence or frequent urinary tract infections, and the area of the nerve fibers in the spinal cord going to the bladder is in a slightly different, more central location than the motor fibers, so some people can have relatively good strength of the legs and still have significant bladder problems. The most common bowel symptom in MS is constipation. Number 5. Motor fatigue. Some people with MS have weakness and difficulty walking all the time, but others may actually walk fairly well for short distances but have difficulty with longer distances. After a certain period of time, their legs become weaker, they start dragging their legs, and they have to stop and rest. To an external observer, this may seem to be unusual. Maybe the person is exaggerating, even faking their symptoms. But motor fatigue is actually very well known in demyelinating diseases such as MS. What we think is happening is that in MS, the nerve fibers are relatively spared, but the myelination is abnormal, and hence the nerve fibers may function okay briefly, but when subjected to stress, such as during prolonged exercise, there may be a decompensation, causing the neurological deficits to become worse over time, and this is very well known and can be quite disabling. Number 6. Uhtoffs phenomenon. This is temporary worsening of multiple sclerosis symptoms in the setting of increased body temperature caused by external heat, exercise, or fever. For example, let's say you had optic neuritis in the past but recovered, you could have worsening vision during a very hot day or during a hot shower. Same thing if you previously had numbness and weakness of the legs, you could have more symptoms on a hot day. This is not because heat injures the nervous system, it's due to prior demyelinating hypermyelination, causing a decompensation in the setting of increased body temperature. Sometimes this can be mild, but sometimes it can be very profound. I've even had some patients who lived in hot areas like Arizona move to Los Angeles, where I am, just to escape the brutal summers and the effect it had on their MS symptoms. Number 7, depression and other mood disorders. Now, certainly having a serious diagnosis like multiple sclerosis, particularly if it's associated with physical limitations, can itself cause a reactive depression, but there's also something different. There's evidence that the lesions themselves can cause depression in a direct sort of neurophysiological way. In particular, lesions in the left frontal lobe are associated with depression. Lesions in the right frontal lobe are sometimes associated with mania or elevated affect, which sounds good, but can be quite disabling. The good news is that standard treatments of depression can be effective in MS-related depression, including counseling and medications. For people who have both depression and fatigue, activating antidepressants such as Wellbutrin can be effective. For people who have both depression and nerve pain, the SNRIs, serotonin norepinephrine reuptake inhibitors, like Effexor and Cymbalta, can be effective. Number 8, spasticity. This is an increase in muscle tone, often associated with muscle spasms and pain. It's caused by a disruption of the motor fibers descending to the spinal motor neurons, which normally regulate muscle tone, and spasticity is not necessarily associated with significant muscle weakness. Some of the treatments include good hydration, a high potassium diet, stretching, magnesium supplements such as magnesium oxide 400 milligrams once or twice a day, muscle relaxants such as baclofen, or medical marijuana. Number 9, cognitive impairment. Now, many people with MS are highly intelligent, and I have a lot of patients who are high-powered attorneys, CEOs, engineers, etc. However, formal research shows that a very significant number of people with MS have some degree of cognitive impairment. It may be subtle with impairment on formal neuropsychiatric testing in things like attention, processing speed, and multitasking. For example, I have one patient who's an accountant, and he had to go on disability because even though he can complete 1 or 2 returns, he simply cannot keep up with the pace necessary to be a successful accountant during a busy tax season. Number 10, sexual dysfunction. Injury to the spinal cord in MS can cause various sexual symptoms such as erectile dysfunction in men, or problems with arousal and orgasm, or pain during sex. A lot of people shy away from talking about these issues with their doctor, which is unfortunate because there are medications that are highly effective for both sexes. So if you have any of these invisible symptoms, or if there are others I didn't mention in the video, I'd appreciate your comments below, or if you have suggestions for other videos. Another point I'm trying to make in the video is that a lot of suffering in general, not just with MS, is invisible. So if you think someone has a simple, easy, problem-free life, think twice.